So what kind of long-term results can we expect in a treatment of a full mouth rehabilitation? Hi, my name is Dr. Dheeraj Punjabi and I am a practicing dentist since last 14 years in dental crafts. So this is a common question which is asked to me by all of my patients which require a full mouth rehabilitation. Basically, just to revise, who requires a full mouth rehabilitation? A person who has problem in one or more teeth may require a full mouth rehabilitation. There are two goals of a full mouth rehabilitation treatment, and those are improved function, that is good chewing power, and the second is great looks, which we call aesthetics. So there are various steps involved in the execution of this full mouth rehabilitation treatment, based on which we can expect good results if we are very meticulous in our diagnosis, in our treatment planning, and in the maintenance. So talking to you about the various steps, the first step is the diagnosis, or understanding what problem the patient is facing who has to undergo this treatment. So there could be many problems like increased risk of cavities, that is multiple teeth are having cavities. There could be a problem where a patient has lost a lot of teeth and they suffer from missing teeth. Then patient may also have severely crooked teeth, which is leading to an unfavorable bite, and the bite needs to be corrected using the FMR principles. There could be a problem which could be more holistic in the approach, wherein the teeth as well as the jaws, the entire chewing system may be at a risk or at a problem, where there could be a problem in the jaw joints which are located in the front of the ears, and patient could experience pain in all these areas. So all these conditions predispose a patient to getting a full mouth rehabilitation at some point or the other in their life. Talking about diagnosis, when we are looking at diagnosis, there are various steps which are involved in the process, right from taking the measurements of the teeth to obtain molds of the teeth related to the patient, then taking detailed photographs which allows us to visualize the problems which could be happening in the patient's mouth, and a few x-rays which tells us the problem could be in the deeper areas of the jaws, which could be the lower jaw, upper jaw, and the temporomandibular joint. So combination of all these helps us to do something called as a study or assessment, in which we understand what is the degree of the problem and what are the realities which we can do. So basically, if the patient is expecting something miraculous, we may or may not be able to deliver that, and it just helps us understand the expectation delivery quotient, like how far we have come in the problem, how far the patient has come with the problem, and with what ease we can solve this problem. The third step is the execution of the treatment, which may involve as simple as teeth colored fillings up to treatments which require a lot of dental implants to be done for a rehabilitation to replace missing teeth, or to change the entire dentition from the right to the left, top to the bottom. So it comprises of a lot of treatments which, when executed at a correct sequence and scale, can bring about desired results. The fourth and the most important is the follow-ups of the patients, which helps us to understand how well the patients are maintaining their third dentition or the new dentistry what we have done in their mouth. Also, they are encouraged for visits in which they have to undergo full mouth cleaning, they have to undergo full mouth x-rays, and a lot of aftercare which has to be re-explained to the patient. So the way in which they were treating their earlier dentitions may not be good, and they are taught various other ways of cleaning their teeth, like effective brushing with a power toothbrush, or something like flossing, which helps them clean the under areas of dental implants, laminates, veneers, and whatever artificial teeth dentistry which have been done. So these are a few points which you need to keep in mind, and you have to remember that at the end of the day, we are here to give you that third set of dentition, but with a good responsibility coming from you as well as us. So if you want to know further, in our channel we also have a video upcoming in which we are talking about aftercare of the full mouth rehabilitation treatment in depth. So stay tuned and subscribe to our channel and look for more updates from us.